The day starts over at the St. John of God Hospital in Lunza. It is Tuesday morning, and more young mothers arrive in the children's outpatient clinic of the hospital. Today is Children's Prevention Day. A lot of examinations are waiting for the little patients. And Dr. Lena Schweiger-Hammelsbeck from Regensburg in Germany, and Sister Rosetta, and Sister Frances, the head sister of the screening department, and Sister Esther, who will start with vaccinations today. More precisely, with the documentation. For that there's a large book in the outpatient clinic where all mothers, all children and all vaccinations are entered. In return, the little ones receive a pension booklet that will accompany them through their childhood from now on. On the cover page, the data of the child and parents are entered, and on the second page, the vaccinations. But first of all, they have to be done. Now they are finished. In the meantime, it has become crowded in the ambulance. After the vaccinations, the newborns are concerned with the clarification of sickle cell anemia. In the malaria belt of Africa, the disease is relatively common. And in order to treat the affected children early enough, a screening consultation was introduced in Lunza. Mama Ramatulai gives Sister Rosetta the data of her little daughter. Everything is noted: the sequential number of the day, the name of the baby, age and gender, the address, and who the closest relative is. With Miriam, of course, that's the mum. And finally, to which tribe they belong. Now everything is in the government's big logbook. Lena has now put on her gloves and Ramatulai has cleared her baby's food. With a lancet, there's a small stitch in the heel, but Miriam clearly comments on it. Not much blood is needed on the test strip, just a small drop. In a test tube, Lena puts 6 drops of filtered water. Shakes it a few times, label with a name abbreviation from the logbook, and then the whole thing goes into the stand and sits there for 15 minutes. Miriam and Ramatulai are done for the moment. A quarter of an hour later, one by one the test strips are taken out of the test tubes. The most important tool is now the template sheet Hemotype SC. The order of the marking strips results in the diagnosis. At best, you turn everything upside down so that the arrows on the template and the test strips both point upwards. Dr. Lena and Sister Rosetta check the red lines together. Safe is safe. 2 strips at the top and 1 at the bottom mean AA. Perfect. AA means healthy, and this is also entered in the document book. But there may be other results. AC and CC, 2 harmless variants of red blood cells. AS, the child is healthy, but can inherit sickle cell disease later. SS and SC, the child has sickle cell disease. If the bottom line is missing, or if all 4 can be seen, the test result is incorrect and must be repeated. Even today, there's a harmless AS finding, and like all results, this is noted at the bottom of the pension booklet. Unfortunately, SS signs have also appeared several times, which belong to children with sickle cell disease. It's a good thing that they are found so early, because now the mother is informed and her baby is accepted into the diagnostic and therapy program. On the same day, the nurse will accompany it to the laboratory for a more accurate blood check. Doctors make the examination and prescribe helpful medications. And once a month, mother and child will come to the outpatient clinic for a checkup. One task remains for Sister Frances in the evening. All documentations from the state logbook have yet to be digitalized. The Klinik Partnerschaft, as financiers of sickle cell screening, expects a list of results. And Dr. Schmidt-Hoensdorf expects the data for scientific evaluation. A few years have passed for the child, and as offered by the care team, there's a regular checkup. Today, Saudato is here with her grandfather. The diagnosis is known, and the findings so far have been documented. But how is she doing now? How has she developed? While Sister Rosetta questions her grandfather, Dr. Lena first checks her weight. It continues with the height measuring and the pulse oximeter, which gives information about her lung and heart function, and the physical findings. For example, the size of the spleen is of great importance. While the doctor documents the findings, Sister Frances prepares a laboratory application and accompanies Saudato to the examination. More than a small drop of blood from the finger is not needed, which then ends up in the centrifuge. A few minutes must be waited. Sister Frances in the lab, Saudato with grandfather in front of it. From the length the blood sample has made in the centrifuge during a certain time, the hemoglobin content can be calculated. And then the control visit is used to recall all behavioral tips. The information brochure, with which Sister Rosetta explains the most important things to her grandfather, has proven to be the best. About anemia, pain, fever, water in the feet, much more, and that a doctor should be consulted if there are any questions. Meanwhile, Sister Frances had issued the monthly prescription with penicillin against certain bacteria, as well as Fansidar as malaria prophylaxis. For today we are done. Saudato looks fit, the disease is well under control, and the long-term prognosis has improved significantly. The sickle cell outpatient clinic has once again done a good job.